All right, good morning, everyone. We have a special guest with us for American Heart Month with us. We have Dr. Mohit Jain with us, with MultiCare with us. You're a cardiologist. Good morning, doctor. Thanks for being here.
Good morning. Thank you for having me.
You know, doctor, I wanted to bring you in. It is American Heart Month, and we wanted to talk about the heart health. But something really interesting is that, you know, a lot of us deal with stress, and stress can really impact the heart. So tell us about the connection between the two.
Yes, thank you for the question. Stress is something that we all face, and in short bursts, stress helps us cope with the situations.
Sure.
But when stress becomes chronic, it can cause heart problems. It can lead to increased inflammation, lack of sleep, and because of that, you can have heart problems.
Okay, you talked about inflammation. So how does your stress cause the inflammation to then impact your heart?
Yes, so when people are stressed, they release their fight or flight hormones, which is the adrenaline and cortisol. And these hormones then attract inflammatory markers. And in the short term, again, that's helpful, but when this becomes chronic,
Sure.
It becomes a heightened state of constant arousal. Sort of like if you think about a car engine that's running
Right.
at very high speed without any rest. So with that inflammation, that causes increased plaque buildup and can lead to higher blood pressure and things of that nature.
You said something about chronic stress. I think so many people at home watching can relate to chronic stress. Life is hard. There's a lot of things going on. Sometimes it feels like we're always stressed. And that kind of raised a red flag for me, at least. So talk about chronic stress. What are some things that we can do to not always be so stressed out?
Yes, certainly. Stress affects all of us with our, work-life balance. It's actually, we're recognizing that it's an important marker for cardiovascular health. And early recognition can prevent long-term outcomes. We recommend sustainable habits to reduce stress rather than drastic changes. Things like stress reduction techniques like meditation, yoga, things of that nature.
Sure.
Eating a healthy diet, exercising regularly, even doing 20 to 30 minutes of movement can have dramatic outcome changes.
And stress can really impact our sleep, and we know sleep is so important for heart health. Talk about how stress impacts sleep and something that we can do to maybe have better sleep.
Yes, it's a very difficult proposition, but stress increases inflammation, raises blood pressure, and it leads to poor coping mechanisms. And because of coping mechanisms, we often want to stay up, we want to drink more alcohol and things of that nature, and that further makes our sleep poor. When we have poor sleep, it increases our cortisol levels, our adrenaline levels, leads to conditions like sleep apnea, high blood pressure, and it just becomes a vicious cycle.
So when you're seeing your patients and you're seeing some signs, are you asking your patients about their stress levels and what they can do?
Yes, most certainly. I think stress has now become one of the markers of that is under-recognized, and we use that to prevent heart disease. Symptoms such as fatigue, persistent fatigue, high blood pressure, worsening symptoms, metabolic derangements, all of these are pointing towards increased stress. So I would say if you're experiencing any of this, your heart is already being affected, and I think it's important to get that checked out.
All right, Dr. Jain, thanks so much for joining us. We will have much more American Heart Month coverage throughout the morning.